The next question is about the time of detection of IGM and IGG antibodies, and I think Dr. Keith Siegel, can you please answer this question?
Sure. Yeah, and I mentioned this a little bit in my talk. You know, it was thought earlier. Well, again, one issue with antibody testing is there are multiple now, many different antibody tests, meaning different formulations of the antibody test. Mount Sinai actually developed the first peer-reviewed published antibody test. That was Florian Kramer, and it, you know, in subsequent evaluations of that test, it has held up very well. So it's a good test. There's other definitely good tests as well in terms of test characteristics. I would say the best data is actually this large study that was published from Mount Sinai, well, pre-printed from Mount Sinai this past week. Anya Weinberg was the first author, that suggested that you start to see IgG really around day 7 after symptoms begin, and that most people will have an IgG response by day 21 after the beginning of symptoms. IgM is, you know, very likely to be earlier. I'd say the evidence in terms of when you start to see the IgM response and when it peaks is less good, but probably maybe around day 3 after symptoms begin, you start to see IgM, and I'm just not really sure when it peaks. So we're, you know, for people that want to assess their either exposure status, we're recommending that 21 days after their symptoms begin is when they should get tested.
Okay, great. Thank you very much for answering this question as well, Keith.